Good morning. Today's discussion or presentation is about diabetes. This is a very, very wide subject that cannot be covered by one session. I might have to increase more than one, so be patient with me. These are some comics regarding diabetes to make the subject more fun than what it really is. The diabetes, to understand it, we have to know that the patient who has diabetes has insufficient insulin to metabolize the sugar that they have in the body, the carbs that convert to sugar, and that results in failure to metabolize these things and has serious consequences. There are many types of diabetes. Type 1, when the patient is born with deficient insulin, and this is a subject that has to be covered with real concern and under supervision of specialists, because the patient will need to have continuous insulin therapy. Diabetes type 2, it appears, some people call it adulthood, but recently it was found that it does not necessarily be in adults only. And usually the patient who present with this are overweight and with many other issues like obesity, lack of exercises, and so on and so forth. The 1.5 diabetes, this is what's called latent diabetes, and it is an autoimmune problem. It starts in adulthood. The gestational diabetes is a patient who is normal without diabetes, but when they get pregnant, they get diabetes. And these people are at risk of developing diabetes in the future. The number of people with diabetes rose from 1.108 million in 1980 to 422 million in 2014. Prevalence has been on the rise more rapidly, particularly in low and middle income countries than in high income countries. Diabetes is a major cause for blindness, kidney failure, heart attack, stroke, lower limb amputation. Between 2000 and 2019, there was 3% increase in diabetes mortality by age. In 2019, diabetes kidney disease caused estimated 2 million deaths. Healthy diet, regular physical exercise, maintaining normal body weight, and avoiding tobacco use are ways to prevent or delay the onset of diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, regular screening, and treatment of complication. The diabetes is a group of diseases affect how the body uses sugar. As we said before, glucose is an important source of energy for the cells that makes up the tissue and the muscles. It is also a main source of energy to the brain. Now, we said before that the main cause has different types. No matter what type of diabetes you have, it can lead to excess sugar in the blood. Too much sugar in the blood can result in serious health consequences. Type 1 diabetes, the following symptoms of diabetes are typical. However, some people with diabetes have symptoms so mild that they go unnoticed. Common symptoms of diabetes: urinating often, feeling thirsty, feeling hungry, even though they are eating, extreme fatigue, blurry vision, cuts and bruises that heal slowly, weight loss even when the patient is eating more. Can these symptoms appear suddenly? In people with type 1 diabetes, the onset of symptoms can be very sudden, while in type 2, they tend to come more gradually, and sometimes there are no signs at all. Symptoms sometimes occur after viral illness. In some cases, person may reach the point of diabetic ketoacidosis before type 1 is identified. Ketoacidosis is a very serious health condition that could lead to mortality. And blood sugar is dangerously high. Body cannot get nutrient into the cell because of the absence of insulin. The body then breaks down the muscles and fat for energy, causing accumulation of ketone in the blood and urine. Symptoms of DKA is fruity odor of a breath, heavy text, breathing, vomiting, and if left untreated, it can lead to stupor, unconsciousness, and death. People who have symptoms of type 1 diabetes, DKA, should contact their health provider. Generally, this is not contact health provider. This is a life-threatening emergency, and the patient should be managed in the hospital, and then when discharged, should be contacting their primary care. Some people in type 1 have a honeymoon period, which is a short period of remission, while the pancreas is still secreting some insulin. The honeymoon phase usually occurs after someone had started taking insulin. A honeymoon can last as little as a week or can last even a year. But it is important to know that the absence of symptoms does not necessarily mean diabetes is gone. Pancreas will eventually be unable to secrete insulin, and if untreated, symptoms will return. Type 1 diabetes symptoms in infant or child. The young child urinate frequently, drinking large quantities of fluid, losing a lot of weight, becoming much more tired, ill in the classic pictures of a child with new onset type 1 diabetes. If the child who is potty trained and dry at night starts having accident and wetting the bed, diabetes may be the culprit. Although it is easy to make the diagnosis of diabetes in children by checking their blood sugar at the doctor's or emergency department, tricky part is recognizing symptoms and knowing to take the child to be checked. Raising the awareness that young children, including infants, can get type 1 diabetes, can get parents to know when to check for the disease. Sometimes the presentation is ketoacidosis. The symptoms, as we said before, it is mainly the same in type 1 and type 2. The issue is the lack of insulin, and sometimes there will be lack of understanding by some doctors that the type 1 can start at an early age, and in people every race, shape, and size. People with type 1 who have elevated blood sugar and a classic risk factor for type 2, such as being overweight, physically inactive, are often misdiagnosed. It can also be tricky because adults with the new onset diabetes type 1 are not sick at first. The doctors have elevated blood sugar on routine visit and should start them on dieting, medication, and exercise. The diagnosis: healthcare provider diagnosed diabetes by checking blood glucose level in the blood test. There are 3 tests that might confirm the diabetes: the fasting sugar that is higher than normal, random blood sugar is higher than what it should be, i.e. more than 180 2 hours after meal, hemoglobin A1C. This is the crux of the monitoring. It is the glycosylated hemoglobin, which provide measurement of the control of sugar metabolism in the past 3 months. The symptoms of type 2. The type 2, type 1, the long latent diabetes, the symptoms are the same. They occur in short period of time in type 2, and the onset tend to be slower. There will be tingling in nerve, slow healing, sores. If left untreated, particularly type 1, as we said, it could lead to dangerous ketoacidosis. It is less common in others. Diabetes is still possible. General symptoms: increasing hunger, thirst, weight loss, frequent urination, blurry vision, fatigue, weight loss at a time when the patient is eating normal, sores that does not heal easily. In men, there will be serious decrease in sex drive, erectile dysfunction, poor muscle strength. The symptoms in women can be vaginal dryness, recurrent urinary tract infection, and resistant yeast infection to treatment, and dry and itchy skin. The complication has high blood sugar damages the organs throughout the body. The higher the blood sugar is, the longer you have to live with it, and the greater the type of risk and complication. The complications are serious. and include heart disease, heart attack, stroke, neuropathy, nephropathy, retinopathy, vision loss, hearing loss, food damage such as infection and sores that can lead to skin condition such as bacterial fungal infection, depression, and dementia, and also the infection can be difficult to control, which can lead to amputation. Managing diabetes. Now, knowing your diabetes ABC help you to manage blood sugar, blood pressure, cholesterol, stopping of smoking. If you smoke, if you stop smoking, will help to manage your diabetes. Working toward the ABC goal can help lower your chances of having heart attack, stroke, and other diabetes problems. Hemoglobin A1C, the average blood sugar control in the past 3 months, the goal should be kept around 7%. You ask your health provider what your goal should be. Blood pressure, the A stands for hemoglobin A1C, B for blood pressure. Blood pressure should be below 140/90, and ask what your goal should be. The third thing is cholesterol. There are two cholesterol types, high density and low density. In fact, there are three: high density, low density, and very low density. The bad cholesterol is the low density, which can build up and clog your blood vessels. Too much bad cholesterol can result in heart attack, stroke. The high density is the good cholesterol that removes the bad effect of the bad cholesterol. Ask your health team what your cholesterol number should be, and if you are over the age of 40, you may need to take statin drug for a healthy heart. S is smoking. For stop smoking, essential and important for people with diabetes, because both smoking and diabetes narrow the blood vessel. Blood vessels narrowing make your heart work harder. E-cigarettes are not safe option either. If you quit smoking, you will lower your risk of heart attack, stroke, kidney, eye disease, amputation, and you lower cholesterol. This may help to improve the blood circulation. You may have easier time being physically active. If you smoke or use other tobacco products, ask for help so you do not have to do it alone. You can start by calling the National Quit line at 1-800-QUIT-NOW or 1-800-784-8669. For tips on quitting to smoke, you can go to 𝒑𝒏𝒕. Keeping A1C, blood pressure, cholesterol level close to your goal, and stopping smoking may help to prevent long-standing harm of diabetes. These health problems, including heart disease, stroke, kidney disease, nerve damage, eye disease, all these can be stopped by better control of sugar and stop smoking. You need to keep a record of your A1C so that you can follow the diet accordingly. That concludes our first presentation for diabetes. I hope you enjoyed it, and I hope you have some information about what is diabetes and how to control it.